Thank you, Mr. Chairman. Thank you for holding this hearing, and thanks to all of our witnesses for your testimony today, in particular to Representative Longden. Thank you for sharing your story, but also highlighting that the incalculable costs, the human costs to gun violence. There are things that we can do. There is not one simple solution to end all gun violence, but there absolutely are things we can do. We can pass universal background checks, and that will have an impact. There's so much more we can do. And if this were treated as a public health epidemic, we would be doing research, we would be learning what works and what doesn't work, and we would keep moving forward. And so, Dr. Satcher, you talked about the importance of research and the investment we make. If we are looking at this from a public health standpoint, what type of research are we doing, and what type of research has happened already? I think you talked a little bit about work that's happened in Chicago and Baltimore that have reduced homicides and shootings. Can you talk about that approach and how we could expand that in terms of the federal work that we should be able to do?
I think that globally and nationally, we have really outstanding examples of where solutions have been found to violence, or violence has been reduced dramatically because of research. In this country, of course, we talk about the work done in Baltimore, in Richmond, California, in Oakland, California, where we have dramatically seen a reduction in homicides, especially because of research. If you have more questions than answers, then I don't know any other way to approach it but to say we need to do more research. I don't know any other area in our country, not HIV/AIDS, not cardiovascular disease, not cancer, where we have stopped research where we had a major health problem. And so I think this reflects, obviously, the fact that there's disagreement in Congress and in society about the nature of research and the nature of outcomes. But I don't think there's disagreement about the fact that we have more questions than answers when it comes to homicide and suicide and other public health problems related to violence. I don't see how we're going to move forward without restoring funding for research. And so, by the way, Dr. Mark Rosenberg was head of the Injury Center at the CDC. I appointed him when I was director of the CDC, and he did a great job. He and Congressman Dickey jointly submitted an op-ed piece to the Washington Post in 2012, in which they agreed about what needed to be done, and research was at the top of their agenda.
Thank you. I also asked the public hospital in my region from Washington State. I talked to our public hospital, Harborview Medical Center in Seattle. They said in the fiscal year 2018, Harborview had $2.3 million in uncompensated care costs, specifically to treating gunshot wounds. That's, the city of Seattle doesn't make the list of cities with the highest rate of gunshot victims. So Dr. Punch, you talked about this a little bit, but can you talk about working in an ER and how uncompensated care impacts healthcare delivery?
Definitely, there are a number of people who present with bullet injuries that do not have insurance, and that care is consumed by the hospital system itself. And interestingly, this is unpublished yet, but we looked at the experience of people who come to the ER where I work in St. Louis. More than half of them are sent home from the ER after being treated for their bullet injuries, not having qualifications or requirements for admission, and then have a difficult time getting follow-up care because they might not have a primary care physician or access to primary care. A fraction of them come to the surgical team for follow-up, but here's the thing, more of them will end up back in the emergency room than will be seen in follow-up with complications of their bullet injuries. So we know that it's not just costing the hospital system money up front to care for people who are uninsured, but frequently there are visits again that occur for complications of that bullet injury because there's not universal standard care, because the disease is not acknowledged as such, and there's no safety net to make sure that those patients get dedicated, focused treatment. Here's the problem. one of the biggest risk factors for having a bullet injury is having had one before. So not treating that disease when it presents the first time, make sure it comes back again.
Thank you. My time's expired. I yield back, Mr. Chairman.